but wanted to kind of kick us off here with a welcome to everyone who's joined us. And I'm going to jump ahead to full screen here and just start off with a little bit of context about why we're holding this session this afternoon and what we're hoping to accomplish over this lunch hour. So really, just to kind of briefly kick us off, as we're really seeing kind of this next phase of vaccinations and seeing a real tapering off in the demand for folks who were previously eligible. The focus has really shifted to those, particularly under the age of 21, where those kind of more newly eligible folks who do have a much lower vaccination rate as a population overall. And in particular for the Health Plan of San Mateo membership, where our members do often face additional barriers to vaccination, we are seeing lower vaccination rates for our population. So really some important kind of equity gaps here that we want to make sure that we're focused on filling and really supporting you as providers for reaching those folks who've not yet been reached. In addition, and Dr. Chabra and others will have more to say on this, but as we're kind of looking into the tea leaves for what the rest of this year brings, with eligibility expanding likely to younger age groups in the near future, really want to try to get ahead of any preparation to become a vaccinator and kind of help our providers to work through some of those questions about the process itself. But again, just kind of a real quick snapshot here of some of those rates that we're looking at here in San Mateo County. A really striking, wonderful number overall on the percentage of eligible San Mateo County residents. That's actually of the eligible folks who've been vaccinated. A significant portion of HPSM members have received one dose, but that number is pretty far behind the county averages overall. And that's again of those who are eligible for the vaccine today, which is currently those 12 and over. But a much lower rate, a little bit over half the rate of the membership as a total for those folks in the 12 to 15-year-old age band. So that's where kind of our focus is for this afternoon. How we hope to kind of get there. We have some wonderful folks joining us this afternoon to help to answer some questions, provide some tips and tricks, and share a little bit more about what it's been like to go through that, both the vaccinator registration process and then conducting vaccines. So I'll hand it over to our first guest, Dr. Chabra. So Dr. Chabra, I wanted to just kick off with a note of appreciation for all you've done for our county during this very tumultuous year and kind of seeing us through a lot of the surge and then the rollout of the vaccine. I know we have pulled heavily from your epidemiology background and guidance as we've really navigated these waters, and wanted to just make some space to share a little bit more with our network about things that you're seeing coming up and tips and tricks for providers who are looking to become a vaccinator.
Great. Thank you so much, Colleen. Can you hear me okay?
Loud and clear.
Thank you. Great. So in terms of overall context, we have almost 600,000 residents of San Mateo County have now received at least one dose. So the number is actually, as of yesterday, 578,899. As Colleen mentioned, we're of the 16 and over population, the county is at 88.5% have at least received one dose. And of the 12 and older population, we're at 86.9%. So doing pretty well overall. As I think you all know, the Bay Area counties have been doing well, particularly San Francisco, San Mateo, Santa Clara, and then Marin being ahead of all the three other counties with the highest vaccination rate in the state of any medium to larger size county. There have been over 1 million doses of vaccine provided to San Mateo County residents. And of course, there have been a huge number of entities involved in that, many practices, as well as the big systems, Kaiser, Sutter, and Palo Alto Medical Foundation, the county, of course, Stanford and Lewis Packard Children's, and then the pharmacies, CVS, Walgreens, Rite Aid, as well as smaller practices such as the Dignity system and the Seton system. So we are, pretty happy overall with where we're standing, but there is still some equity gaps. There's about a 12.5% equity gap between folks who live in the higher income neighborhoods in parts of the county, places where there are more resources, people have access to care, people have insurance, and then the communities which are, more challenged, have more COVID cases, and also may have transportation issues, language barriers, access barriers, etc. And in some cases don't have insurance, though certainly for kids, pretty much everybody is insured, which is great. I will note that of the 12 to 15-year-olds countywide, 62.4% have had one dose of vaccine and 50.7%, so a full half are already fully vaccinated, or at least have completed their vaccination series. Of course, they have to get Pfizer because that is the only vaccine approved for the 12 to 17-year-old age group. As you also know, the volume of vaccinations, as Colleen mentioned, have slowed down over the last number of weeks. So then no longer is a supply issue. Initially, and for many months, we did have supply issues, and there really wasn't the opportunity to provide as much vaccine to private providers, smaller practices. But that has changed dramatically over the last, I'd say, a month and a half or so. Now there is abundant vaccine supply and to some extent lesser demand. And so our response to the pandemic is definitely changing collectively in order to address these shifts in what's happening. As we have more, small practices, and this may include a number of pediatric practices, we as the county will work closely with you on either redistributing vaccines, so vaccine from, the county's supply that we have sitting in a freezer. There is a vaccine marketplace, which is a statewide marketplace for vaccine, people who have expiring vaccine, trying to get it to people who need vaccine so that we waste as little as possible. There will also be the opportunity to place small orders of vaccine. So up till now, you had to order at least 100 or 140 doses of Moderna, and then it was, 1170 of Pfizer, and then 450 of Pfizer. But you will have the opportunity to order much smaller quantities, as little as a vial of vaccine, and we as the county will work with you to get that vaccine to you, or to arrange pickup for that. So we have a whole team. Many of you have heard from Gwen Trent or Robin Ziegler or Ankita Tandel or Laura Shi regarding when you place an order into MyCA Vax. We'll often contact you and say, actually, it'd probably be best not to get that from the federal government because there's supply available with this provider. Let's help you coordinate pickup of that vaccine. And so you'll be able to order much smaller quantities, and that should really help in terms of storage. I think most of you are aware that now the Pfizer vaccine can be kept in a refrigerator for a month, and so that makes it much easier to work with than it was in the past, where you only had 5 days to use it, basically, once it was unthawed. So the small order process, I think, will be really helpful for smaller practices to get, so you can just vaccinate a handful of people a day. And we're also less concerned about wasting of a few doses of vaccine, because we know that sometimes, in order to vaccinate 1 or 2 people, you're going to have to open a vial, and that's okay. And we know that might mean 3 or 4 doses get wasted, and that's acceptable at this point because the vaccine supply is abundant and there are fewer people overall to vaccinate. So what do we see coming down the pike? So we are anticipating full FDA approval sometime in the summer, though I don't have any particular knowledge on that. That's sort of what we're hearing from a number of different sources. Pfizer submitted for full FDA approval at the beginning of May. Moderna did at the beginning of June. So the Pfizer's already been with the FDA for full approval for 2 months, and so we're hoping that sometime in the summer it'll be full approval rather than emergency use authorization. We believe that may interest some people in getting vaccinated. Of course, again, we're hoping that Moderna will get approved for the 12 to 17-year-old group. They have submitted that request to the FDA. And then we anticipate in the fall, maybe September, maybe later, that children under 12, and it could be 5 to 11-year-olds, or it could be 2 to 11-year-olds, we're not sure, will probably get approved for Pfizer first. And so that's really where particularly hoping to get pediatric practices on board, ready to vaccinate that 2 to 11-year-old, as well as any remaining 12 to 17-year-olds vaccinated. We're really seeing for the pediatric population that the best place for them to get vaccinated is going to be with their provider, rather than at a community site or a mass vaccination site. It will, of course, allow you to catch them up on their routine immunizations, which, as you know, have lagged a bit during the pandemic. And also just a great opportunity to do well-child visits, well-teen visits for kids who might not come in otherwise. And so we think this could be a win-win for particularly the pediatric providers, but also smaller adult providers. We're hoping that some pediatric providers will also vaccinate parents when they're vaccinating the kids. And I think the reimbursement is fairly good. I believe it's $40 per dose for Medi-Cal patients. So that's better than, with other vaccines. And you'll hear some exciting other resources from our colleagues at the California Medical Association shortly. So a lot of things to try and make this easier to do and more attractive. The MyCAVax enrollment process has been simplified. It is a requirement in order to get COVID vaccine because it's federal vaccine, and part of the registration is your agreement with the CDC, essentially, to follow their guidelines. And of course, the information does need to be entered into the California Immunization Registry, CARE2, also into Vaccine Finder. And so there are some stipulations about participating, but hopefully this will be the resources you hear about today, and the experience of some of your fellow providers will be encouragement for any who have not yet signed up in MyCAVax.
Thank you, Dr. Tarver, for walking through all of those questions. I wanted to hand it over to you, Mike, with a little bit of background on where you're joining us from. So excited to have you here today, as you've been kind of supporting a number of practices through this process. But I'll hand it over to you to give a bit of an intro to the group and kick us off.
You bet. Thank you, Colleen, and thank you for the invitation to join you today. And thank you, Dr. Copper, for the work you're doing there in San Mateo and the collaboration that you have with us. I'm Mike Steenberg. I'm the Vice President of California Medical Association. I primarily lead marketing and membership, but I also work directly with our component societies that are located throughout the state. And so in the last, we've been working very closely with the state and with all of the LHJs during the pandemic in a variety of ways, but specifically as it relates to the vaccine distribution efforts. We have been really focused on trying to assist in navigating for providers the onboarding process. I think if you want to go to the next slide and go, there you go. Thank you. Again, this is a little bit of a high-level overview of the onboarding process. I think most of you will probably be familiar with it. I want to say up front that as soon as I make a slide, sometimes it gets outdated very quickly. So just feel free to reach out to us directly, and we're more than happy to help you navigate this process. But also, obviously, with the resources you have there locally, which are phenomenal, you can have that local support to help in this process. As previously mentioned, to receive vaccines, you have to be registered in CARES 2, and then you have to utilize MyCAVax. And that for some we have found, and just in our interactions with hundreds, in fact thousands of providers around the state, and I think especially with primary care providers that maybe initially in the early part of this year were not able to enroll for a variety of reasons onto they could start the process in MyCAVax, but many of them abandoned it or did not pursue it. And we understand that there's, it can be frustrating to get into that entire process. And so for those reasons, we approached the state and we stood up a group within CMA, dedicated 30 employees to be fully trained in the process. And they were granted by CDPH full access to MyCAVax. And so they actually have been trained to work as practice liaisons and work on a one-to-one basis with practices that are trying to get onto MyCAVax. And the state has some tremendous resources on their website, but a lot of times, it just takes that personal service and someone, that can dedicate some time to help you learn that entire process. And so that's what we did. We've dedicated those staff to that. We continue to support that, and we've helped hundreds upon hundreds of providers to navigate this process. In addition to MyCAVax, was already previously mentioned, you can utilize the marketplace for vaccine sourcing. If you need small doses, or if you need something quickly, or if you're just trying to help someone, or if you yourself, once you become a vaccinator, if you have vaccines that are going to expire, this is an opportunity to move them into the hands of someone else that can maybe utilize them and make use of them before they expire. But it's also a great way to acquire smaller doses of vaccines for your practice in a very timely way. In addition to the support that you get from your county Department of Public Health, as well as potentially the state as well. If you have to utilize MyTurn for reporting purposes, our staff is fully trained in that onboarding process and can provide you with personal service and personal assistance, excuse me, in administering that and helping you navigate that as well. And we can help you with Vaccine Finder and all the other little nuances and things that you have to make use of. If you'd like to take advantage of that service, we have a very simple and dedicated email. It's there on your screen, vaccinenetwork@cmadocs.org. Very simple, just shoot us an email. It will be immediately assigned to one of our practice liaisons who will respond to you same day and check in with you and then help you navigate that process. And we'd love to help you as much as possible. So if we can go to the next slide, I'm going to take this opportunity to devote most of my time to actually a new program that is just launching. It actually goes live next Monday on the 12th, but CDPH has very graciously given us the opportunity to administer a grant. It's called CalVax Grant, and it is a grant to help providers that are interested in, are already currently enrolled in MyCAVax and vaccinating, or are interested in enrolling and moving through the process and becoming vaccinators. If you want to go to the next slide, Colleen. Here's some, I'm sorry, go back one. So here's some very general details about the program. It's intended to support practices up to 200 physicians in size. So especially smaller practices with fewer physicians, we'd love to provide you that level of support. You must be registered in MyCAVax. To initiate the process on the grant application, you have to start by enrolling in MyCAVax and completing Part A, which is the first part. It's very, very simple. Probably would take less than an hour or even much less time than that, most likely, to complete that Part A. If you have any issues or questions, again, feel free to reach out to us and we'll provide that level of support. CDPH has made $37 million available through this grant program. The open application process starts next Monday, July 12th. It will be open for 30 days. And so you can enroll during that period of time. And the program is being administered by Physicians for a Healthy California, which is our nonprofit subsidiary. Next slide. So the program is created as a block grant, meaning very simply that you receive $10,000 in support per site. If you have multiple offices or sites, you can qualify for up to 5 is the maximum. So if you had 8, you'd get support for 5 of those 8. If you have 1, it's just $10,000. And let me add real quickly, go to the bottom part of that slide, which just simply says there's an equity index. I want to add to that so I can get the right amount. If you are in a quartile 1 zip code, and that is, we have those listed on our website, we can provide those to you. But those, you receive an additional $1,000 per location. So hypothetically, if you had 5 sites, all 5 are located in these quartile 1 zip codes, you would have a maximum award of $55,000. If you're a single location provider or practice and you're in one location, you could receive either $10,000 or possibly $11,000 if you're in the quartile 1 zip code. The expenses that are permissible for this grant are staff time, training, technology, infrastructure, supplies and equipment, and administrative overheads. Pretty broad. This is a self-attestation. You're not required to provide us any type of receipts or proof that you purchased equipment. If you need to, because not everyone has to do that, but if you do, that obviously is covered. But what we have found when we created this program with CDPH, the intent of it was to make it very simple and make it a very easy application process. The entire application is probably would only take a few hours, and we have lots of staff support if you need it. But the idea is that to meet the criteria is if you have enrolled in MyCAVax and been approved and you've completed that process and you've ordered vaccines, then essentially you have met the standard that we're looking for, because you probably have committed enough staff time and enough training time and provided enough technology support and infrastructure support that it would meet the threshold for the $10,000. Again, this is a self-attestation, so when you complete the application online, you just attest that you have exhausted these funds. You must complete Section A and B to receive the funding, but you most importantly have to start by completing Section A to start in the enrollment process. You have to either spend or plan to spend essentially that $10,000. And again, I want to emphasize that it is a self-attestation, and it's very liberal as far as looking at the amount of staff time and training and the work that you have to do to work through the MyCAVax application process. This is retroactive. It goes back to November 1st of 2020 and through November 1st of this year. So if you're already by chance enrolled or you're in MyCAVax and you're even vaccinating right now, we'd love to honor you and get you into this application, this grant process, and award you the $10,000. You have to have an unrestricted license and be in good standing with your licensing board. Next slide. And there's the information on how to learn more about it. The website is live, calvaxgrant.org. That is a dedicated page attached to our Physicians for Healthy California website. There's a dedicated email, calvaxgrant@phcdocs.org, and a dedicated phone line, which goes to a call center at CMA, which has been dedicated to just this particular program. And that number is 916-551-2565. We're happy to provide you more support. Currently on the website, there's some general information. There is an FAQ document, which gives you a little bit more clarity, a little more detail around the program. But the application, the e-app, does not go live until the 12th. So that's when you can actually apply for the grant. And that's all I have.
Great. Thanks so much, Mike, for sharing that, and a really, I think, valuable and timely information on this new grant program. It's very, very exciting. I'll again pause for any kind of quick questions that folks have. If not, we will save questions for the Q&A portion at the end. But any pressing questions for Mike from the group? Right. Well, thank you again, Mike, for sharing more about that and those contacts. I think this will be very, very helpful for our network. So jumping in now, we're very lucky today to have two of our providers joining us, including Dr. Azmina and Dr. Knifton. Dr. Azmina, I wanted to introduce you first and kind of turn over the floor for some thoughts on vaccination so far and kind of lessons learned. But just to sing your praises a little bit, Dr. Azmina, you are a network provider of longstanding with the HPSM network, and your Live Well Clinic cares for many of our pediatric members. So just very delighted that you could be here today. I will hand it over to you. We had a couple of questions just to kind of get your thoughts on here about kind of what you wish you'd known or anything else, but I'll hand it over to you for initial thoughts and introductions.
Thank you, Colleen. It was pretty easy going into the MyCAVax process. I think I called them their IT people a couple of times, though. I would tell providers not to hesitate to give them a call or send them an email. During the process, there was really some technical issues, but it was very easy to get in touch with them. They called me back quickly and resolved those technical issues quickly. So I did not enroll with my turn. I wanted to just offer the vaccine to my patients. I didn't want to have to enroll the parents or new patients. So I'm currently giving Pfizer vaccine to just my pediatric population. And one piece of advice, pull those patients ahead of time. I have an MR, but if not, you can pull charts for 12 years and above. And so I pulled that list and had to go through the names first, since majority of them, fortunately, already got the vaccine. I started giving the vaccine exactly 21 days ago. We are now into our second dose Pfizer vaccine starting today. So when I pulled it, majority of my 12 and up were already vaccinated, which was wonderful. However, those that were not, was surprising that they had a variety of reasons, and some where they were just waiting for me to get the vaccine and come to our clinic. In terms of convenience, some of our parents have multiple jobs, and it's hard for them to find a place or schedule it with, even if it's just at a Walgreens, they would prefer to come to us. So it was good to be able to offer that to them. And the problem, though, is Pfizer has a vial that needs to be 6 patients or 6 doses need to be dispensed within 6 hours. So we have a 9-hour day, if you include lunch, and we had to make sure to get those patients in within a 6-hour time frame. That was a little bit challenging, and that's why we chose to only vaccinate between 6 to 12 patients with COVID per day, in addition to our daily load of patients since we, are continuing to see. And I am a solo practitioner. I do have a part-time physician helping me. So we are already a busy practice, and on top of that, we're giving the COVID-19s. However, we are familiar, since we do give flu vaccines, and during flu season we do have a lot of extra vaccines to give during our normal regular days, which are already busy during the winter. So we're very familiar with that, and it's just the challenge was the 6 hours, 6 patients in 6 hours. So we don't like to waste. I think we only wasted, out of the almost 100 patients that we've given, only wasted like 5 total doses. So we had one day we had to waste 2, but most of the time, we were able to call and get that one extra patient in because somebody didn't show. So overall, we feel we've done a really good job during these past 21 days, and now we're, like I said, into our second. So we chose not to give, well, we actually went through our list pretty much. So there were a few, obviously, that refused completely, no matter how much I tried to convince them. So we're pretty happy that we were able to get majority of our 12 and up vaccinated.
Great. That's wonderful. Thank you so much for sharing, Dr. Yasmina. Really helpful tips across the board. I will say we've come a ways on data sharing too since the early days of this, and so maybe not so much helpful for your practice, Dr. Yasmina, but for our network, we do now have the ability to pull based on an extract from CARE2 data on unvaccinated members who are assigned to a PCP, if that's helpful in that record review, to kind of cross-check that as well. Just from what we're seeing, we can provide that now to any provider to give them a bit of a list. Any other kind of thoughts on those kind of conversations with families or around the vaccination and kind of the concerns that they might have had? You mentioned a lot of folks wanted to really come in and actually receive the vaccine from their provider. Was there anything that worked well in those conversations around hesitancy or just questions that folks had?
Nothing new. As a pediatrician, we're used to having some hesitancy, and with flu or with other vaccines. So it's the usual.
I'd like to now introduce Dr. Connie Knifton, who is joining us from After Hours Pediatrics and has been doing a great deal of work with her clinic that provides urgent care to also both test and now very recently vaccinate members. And if I can get my slides to jump over here, Dr. Knifton, I'll pull up your proper introduction. But again, another private practitioner here in our community, and wanted to hand it over to you to say a little bit more about what you've been learning with the registration process and now today, I believe, vaccinations.
Colleen, I don't know if I'm on or not.
I think you are now. I can hear you loud and clear.
Okay, great. We've got construction going on outside. So just wanted to introduce you to our clinic here, and we are clearing it from our current patients for COVID clinic. But I'm going to try as best as I can to show you how we actually do it. Okay, there we go.
Yeah.
So, and this is helpful. We're going to just do a really quick look. Actually, we're doing COVID testing today also. So that's our COVID testing software. But when she comes back, I'll have you show how we do that. Here's just an example of the vaccine card, which you've all seen. And we made little baby labels. So to save the time on that, and I'm happy to make those for you. Little things like that can take a few hours of time to figure out, and we're happy to share all of them. And I'm just walking through here so you can see what we have. We do have an extra refrigerator if somebody needs one, but we have extra drinks in there for our patients. We have the Be Safe posters all across of our clinic. We have little prizes for our patients after they get a shot. And I think they're ready now. Lupita, are you two ready? Okay, so we're having here our mock-up. Lupita is one of our new medical assistants, and She's going into one room, and Carmen is being trained today, and she gets to be our patient. Okay, so I'm going to have you ladies speak really loud.
Okay. You're here for your first dose? Yes. Okay. And then can I just get you to confirm your date of birth, please? 3/11/88. Thank you. And are you feeling sick today? No. Okay, and you said this is your first dose. And have you ever had an allergic reaction to any food or medication where you've had to use an EpiPen? No. Perfect. And have you ever had a positive test for COVID-19? No. Okay. And are you currently pregnant or breastfeeding? No. Okay. And would you like to do your left or your right arm today? My left arm. Perfect. I'm dominant on my right. Perfect. I'm just going to go ahead and get some gloves.
And just here, you see we have the supplies ready. The Band-Aids, I usually give that job to the mom to open up the Band-Aid because it takes time, or the patient. And we have the expiration date of the vaccines there. And
I'm going to go ahead and put this right here. And then I'm going to go ahead and get a wipe just to go and wipe the area, okay? Okay.
And I think we don't need to do that. Why don't you just go ahead and give her a shot? They've done plenty of vaccines.
On you. And then we're going to watch you for 15 minutes. I'm going to give you a handout. Okay. That goes over the common side effects that people might get after getting the COVID shot. Okay. So some of them are body aches, fever, chills, and sore arm. And then right here, we also have a QR code that you can go ahead and scan with your phone. It's your Be Safe. And what you can do is it logs your symptoms, but just to let you know, there's no one on the other side actually looking at your symptoms. Okay. So if you do have any concern, go ahead and give us a call and we can go from there. And then on the back of this card, or the back of the handout, it talks about myocarditis. So it's inflammation in the heart. Okay. It's not as common in women, but it can still happen. It's more common in boys and the younger adults. Okay. So if you do feel like any of that, or for shortness of breath and fluttering in your heart, have someone at home and then take you to the office a call, and then we can guide you from there, okay? Okay. And this will be for you. Thank you. And just grab the front and the back while you're waiting for your 15 minutes to be up, okay? I think I can't breathe. And I'm having, what are your symptoms? What do you feel? I just can't breathe. Has this ever happened to you before? I think so. Okay. Let me go ahead and I forgot to mention, I get panic attacks. So I'm going to go ahead and check your oxygen, okay? So I'm going to go ahead and get your index finger, please. And then I'm going to go ahead and put this, and then I'll put this right there. And then I'm going to check your pulse. Are you feeling a little bit better? I think so. So everything looks good. You can go ahead and have it right here. And then I'm going to go ahead. I just have and I'll go ahead and take it out just in case I do need to use it, okay?
Why don't you show us what's in there?
So there's some Benadryl in here, just in case we do need to use it for you. And then we also have Benadryl in the liquid form as well. And I'm going to go ahead and grab
You could just show them the EpiPen and the dosing too.
So we have this right here.
The Epi.
Yes.
Is to give the Benadryl. The Epi. Epi was out of stock for a while, by the way.
Mhm.
And then we also made a chart. And we did this after learning that that our nurses and NPs were a little panicked. So it was very helpful. We've actually had one person with a mild anaphylaxis. Okay, great.
Go ahead and grab the doctor just so she can go ahead and talk to you a little bit more about everything that you're feeling. Okay, thank you so much.
And how long would she need to wait?
So now we're just gonna go ahead and watch you for 30 minutes. If we need to watch you for a little bit longer, if you're feeling obviously as we did a little bit ago, we'll watch you for a little bit longer. Okay.
Great, thank you. Okay, ladies, why don't we show them? Do we still have time, Colleen, to show how the vaccines are drawn up?
We absolutely do. Thank you so much
Okay,
for this
come on,
demonstration.
ladies. Okay. And I will mention too, we are doing, we usually have 2 rooms set up to do the vaccines. And again, it will be great. We will apply for that grant to help cover the cost of the laptops. So on most clinic days, COVID days, we also have COVID testing going on during the day. We try to do testing or vaccines during our regular clinic.
Mhm.
Yeah, it just wasn't doable. So these are how everything. So it comes with a diluent, and it comes with certain vaccines. It's really very easy to do. Everything comes, and so we just have done what we've done. We just set up an area just for COVID vaccines. Some of the things you need to do. Right now.
Oh, Dr. Daphne, I think we may
I
have
don't know if you
lost.
can see that.
Yeah, I think we may have lost reception
What's
for
that?
just the last 10 seconds there. If you could repeat the last 10 seconds on this portion of the room.
This is just something I find very helpful, and I have given to Julian all the PDFs that I wish somebody had given to me to read, and shows like what things to read through, which ones to print out. But we just store them in here, and this is how, we have that many. Which is, I think, 168. We use their little temperature chart, which you're required to use. I don't know if all of you providers have a digital data logger, but this was a big block for many of us, and our nurses still like to use the one that we've had for 10 years. We got new refrigerators that have automatic alarms on them, and as well as that lockup, and those are very helpful. So we know right away, the alarm is annoying. So those work. And then I just want to show you here, this is our parking garage, and they're actually patient.
Oh, and Dr. Nyman,
Right.
we may have lost reception in the garage. Nope. Oh, there we go. Dr. Nyman, I think you lost reception when you stepped into the garage. Yeah.
The last year, okay. You just see the parking garage. So that's pretty much how the clinic runs. And
That's fantastic.
I did create a little handout.
I just wanted to let the group know that we will send out PDFs of those handouts, which just thank you so much, Dr. Kniveton, for sharing those.
Great.
And then also, I think as we were touring your garage, we may have lost some of the audio there. Wanted to just ask what you've repurposed that space for.
Yes, and that we have repurposed our garage space for our COVID exam room. So actually throughout the pandemic, we have not seen patients indoors. We see anyone with any COVID symptoms outside. So, and on initially that was also a problem with the vaccines because of the 15-minute wait time. We didn't have the space to have patients wait 15 minutes, 6 feet apart. So we will also sit them out in the parking garage. And just little things that we have learned with the 15-minute wait time, especially when the inside gets crowded or the outside is very hot or cold. We have allowed patients to wait in their cars if they have a capable adult with them. So, Bill, thanks. And I don't think I was able to get it onto you earlier, but this has all my little tips that I wish someone had told me. And I have that available if anybody would like one. It has my phone number on there. I just wished I had somebody that I could go and see how it was done, see how simple some of the things were. And as our prior speaker said, it was a hard to navigate on my own. And it's so easy now. Even little things like, what kind of an ice chest do you use? And we just got a little Yeti one from Walmart, and Safeway's ice, water bottles to store the refrigerator. It's just so much easier if you have someone. And we are always teaching. We have NP and PA students. We're teaching new staff. And all of us love to teach. So if you have any questions, just come on by, give us a call.
Great. Well, Dr. Nyman, thank you so much to you and to your team for the demo today and for offering up that wonderful teaching resource. Just wanted to put out a plug. If you have more questions after today's session, we will be sharing our materials. We'll share the slides with those updated vaccination numbers that Dr. Chabra mentioned, and contact info. And Dr. Knifton, I saw your hand up.
Yes, I did have a question for Mike, actually. It was a little challenging with my turn. And just like Maria talked about, we decided to use my turn because we wanted to draw all of our patients in. And with my turn, people can readily find it. Otherwise, there's not a way to find who gives a COVID vaccine. So that is something, if you want to outreach, to use the My Turn system. And the training videos and all the paper was tremendous, but it's actually very short. But Mike, for you, the question was, we have wanted to do a mobile clinic. For example, go to preschools or daycares when they are in the past schools in the high-risk areas. And My Turn did not allow us to do that. And I don't remember all the details, but I'm wondering if we are able to do that with CMS working with us.
Yeah.
And could the funds be used to do like a mobile site?
Sure. Well, and let me give the first good news is that we'd love to help you get the grant. Absolutely. The work you're doing there is tremendous, and you would meet the threshold just based on what you've already accomplished and what you've already done. So you would be completely entitled to that grant. So we would love to connect with you. I'll reach out to you personally and make sure that we get you through that process very quickly. To answer the question on My Turn, that is one of the things that it has changed over time, and as the state and the counties began to use My Turn in the MyCAVax program, there were constant revisions and enhancements, and throughout about every 2 weeks there was something new being added. So I would emphasize that you can use My Turn as a closed clinic. So you don't have to fear if you want to use My Turn for reporting purposes, so that way the vaccines do get written back to care to appropriately, and that can be a little bit easier to do for for smaller practices. You don't have to be concerned about your clinic appearing publicly. It can be what we call a closed clinic, and we can help provide that support to make that happen. The other scenario that you asked about, I do think there would be a solution that we could probably work with you on. Again, with My Turn, you can utilize it a variety of ways now. You can actually, in addition to having a closed clinic, you can actually use codes that can be granted and used you can be distributed to maybe a subset or maybe a targeted group that you wanted to reach out to or do outreach to. And that way they could utilize those codes to register on your My Turn clinic.
Yes.
And also My Turn now can be used as a walk-in clinic. So I think that would probably be the most appropriate way to use My Turn in that situation. In fact, we've helped a number of clinics that have done mobile clinics or scenarios where they need to be more flexible. You can just register people as they walk in My Turn. So. Yeah, that's a great question and great series of questions there that I think basically illustrates it does have a lot of flexibility now, and we can help you with all those different scenarios.
Thank you so much.
You bet.
I am indeed. Thank you, Dr. Chabra. Just talking to myself over here. Just wanted to extend a huge thank you, if we don't have more questions from the group, to our speakers and to those who joined us today. Dr. Navchan, Dr. Asmina, Dr. Chabra, Mike, thank you so much for sharing your insights as we gear up for greater eligibility for vaccines this summer.